Emergencies don't happen often, but when they do, there's not much time to react. To be effective, you must know what to do when a person appears injured, seriously ill, or in distress. Your skills may never be needed. However, you could someday save a life. Take a certified first aid training course to learn life-saving skills, such as CPR and the Heimlich maneuver, and how to recognize signs of a heart attack, shock, and traumatic injury. Check with your local Red Cross, county emergency services, public safety office, or the American Heart Association for information on first aid and related courses that are offered in your community. CPR. Cardiopulmonary resuscitation, or CPR, can save lives in many emergencies, including when someone's breathing or heartbeat has stopped, such as from a heart attack or near drowning. CPR can keep blood flowing to the brain and other vital organs until medical treatment can restore a normal heart rhythm. Ideally, CPR involves chest compressions combined with mouth-to-mouth rescue breathing. But if you're untrained or unsure of your CPR skills, do hands-only CPR, unless the person in need is a child. Before you begin. Before starting CPR, assess the situation. Is the person conscious or unconscious? If the person is unconscious, tap or shake the shoulder and ask loudly, "Are you okay?" If there's no response and another person is able to help you, one of you should call 911 or emergency medical help while the other begins CPR. If you're alone but have immediate access to a telephone, call the emergency number before starting CPR. If an automated external defibrillator, or AED, is immediately available, bring it near the unconscious person. Voice prompts from the device will guide you step by step on its use. If advised to do so by the voice prompts, deliver one shock and then begin CPR. If you are alone and the victim is an infant or a child, ages 1 to 8 years, perform 2 minutes of CPR before calling for help or getting the AED. Think CAB. To remember the steps of CPR, think CAB: compressions, airway, and breathing. Compressions. Restore circulation. After you've delivered one shock from an AED, or if an AED is unavailable, begin CPR by starting chest compressions. 1. Put the person on his or her back on a firm surface. 2. Kneel next to the person's neck and shoulders.